The United States healthcare system is similar to that of many other countries in that it's a mixture of both private and public components. Let's start with the easy stuff. Almost all care is provided for by the private sector. Although some hospitals are run by the government, most are run by private organizations. About 70% of hospitals are nonprofit, leaving the rest in for-profit hands. Most physicians, therefore, also work for private organizations and are not employed by the public sector. Other components of the healthcare system are also in the private sector, including pharmaceutical and medical device companies. Research is paid for by both public and private sources, with a little bit more coming from the private side. Added together, however, U.S. spending on medical research accounts for the vast majority of R&D spending in the world. But where countries differ the most is in how they give citizens access to their systems. In this area, the United States is somewhat of an anachronism. Until recently, about 15% of people in the United States were uninsured. This meant that if they needed care, they'd have to pay for it out of their own pocket. And unless you've been living under a rock, you should know that healthcare in the United States is really expensive. So that's a problem. It means that a lot of people don't get the care they need, and it means that we're failing a large number of people who live in the United States. About 60% of U.S. citizens get health insurance from their employer. These plans usually don't charge people different amounts based upon factors such as age, gender, or past medical history. They range in benefits, but for the most part, they cover preventive care, care if you get sick, and prescription